Good morning. Today we're going to be talking about hypertension. Now, hypertension is of great concern to all of us as Nigerians because it's a condition that afflicts us as Black people, and we need to know how important it is and what it is that we can do about it. The World Hypertension Day is coming up on the 17th of May, but we want to seize the moment and use the whole of May as a point for people to focus on high blood pressure and to know what to do about it. Good morning, Dr. Ali and Dr. Chinasa. It's a pleasure to have both of you on the program.
Thank you very much, Dr. Ajayi, for having me here again to speak on hypertension.
Thank you so much for having me.
Now, it's a pleasure to have both of you, and both of you specialists in your own different areas. So let me just start with Dr. Ali. Dr. Ali, as a cardiologist, can you tell us simply what is hypertension and why do people need to know about it?
Hypertension is simply elevated blood pressure in the systemic blood vessels. That is, when blood pressure is higher than normal in the systemic blood vessels, because we also have hypertension in the pulmonary, in the lungs. But we're talking today on elevated blood pressure in the systemic blood vessels that comprises the aorta that rises from the left ventricle and its distribution to every other part of the body. So high blood pressure is very rampant, is very common, and it's on the increase. That is just the problem now. It's really pretty much on the increase, quite because of a number of many things, because many things are happening right now. There's economic stress, there is social stress, there is financial stress, there's general stress all over the world. So we see more and more of it, even more than before. The risk associated with elevated blood pressure includes the modifiable and the unmodifiable risks. Risk simply means what are the things that can come in someone that can make high blood pressure, elevated blood pressure, the person more susceptible to elevated blood pressure. That's what we mean by risk. And we all have to know about this risk, so that when you are aware of the risk, you will be able to be more aware that, look, you need to check yourself with regards to elevated blood pressure. Simply because elevated blood pressure is symptomless. So you need to check your numbers. You need to check your figure so that you don't fall victim of a preventable complication. This risk,
Can you
as
tell
I said
us,
earlier,
yes, the different factors, yes. Which ones are the modifiable ones and which ones are the non-modifiable ones?
Okay, the modifiable risk factors are factors that we call lifestyle factors. Lifestyle, which includes our diet, our our weight, exercise regime, stress level, the environment we find ourselves, even marital level, marital stress, the communication on a day-to-day basis, going to work, even the air you breathe in, all is inclusive. Your general well-being, the hours you sleep. So they're all part of it. The amount of salt you consume, smoking, the quantity of alcohol you drink, all these are part of modifiable risk factors. The unmodifiable
ones? Yes.
The non-modifiable ones are your age, because it is well known that as your age increases, and the blood pressure also increases. The sex, it's commoner in males than females until the female becomes a male. Sorry, that's post-menopausal. And then also familial, some hereditary familiar traits are also part of it. And of course, your race is part of it. And as always say that you don't choose your parent. You know, you cannot. You don't have any. And you don't choose your parent. You don't choose your race.
So I want to talk a bit more about the race,
that you
if you
cannot
don't mind.
modify.
I was asking a bit more about
Yes.
race, because
Yes,
it is said that Black people have more of a predisposition to high blood pressure, to hypertension. And in fact, what I'd like you to first define is, what is high blood pressure? Some people say it's 130 over 9, over anything over 120/80. Some people say it's 140 over 90. There have been different, discussions in the scientific journals. What for our own purposes in our own area here in Nigeria, what constitutes high blood pressure?
Thank you very much, Dr. Ajay. The static figure, it's a range. And for the Nigerian, by the Nigerian Hypertension Society, which also goes with the WHO, that World Health Organization, which also goes with the International Society of Hypertension, the range is systole 90 to 130, and the diastole, that's the lower one, 60 to 80 millimeters of mercury. It's a range. Systole, that's the upper figure, 90 to 130. The lower figure, that's 80 millimeters of mercury. Although sometimes when someone comes in with a blood pressure of 120, 80, but with target organ damage, then that person qualifies to be there's already establishment of organ damage. So many things, but that range plus or minus, organ damage. Anything above 130, 80, then with or without organ damage, the person is qualified to be called to be diagnosed with high blood pressure.
Now that's very important, because in fact, as doctors on air, we've done a number of medical missions, and they've come up with so many people having high blood pressure. Many of them having systolic pressures of over 200 and not even knowing it. Now, what is it about us as Black people that makes us have this really exceptional high blood pressures and makes it so common?
Well, the reason why Africans have elevated blood pressure is not because of any form of apart from the genetic predisposition, and the fact that as you grow older, individual, as you increase in age, blood pressure increases. It's simply because of care. That is the bane of it. Poor healthcare. Because it's a symptomless condition. You need to check, you need to know your figures before you can be aware that you have the condition. In a situation whereby this is a low resource setting, where we have poor health facilities, people don't even know where to go to, people don't even check up their health, so because it's a symptomless condition, the condition will have been there over years. So by the time the individual is detected, end organ damage, the blood pressure is so high, and and on and on. Plus the fact that we have quite a number of intercurrent communicable diseases that can even affect our organs, African organs. For example, malaria. We have what we call malaria nephropathy. Sorry to use that big word. And we have intercurrent infections that causes glomerulonephritis and all these things. So, and because of poor health care, baseline, all these things they're not detected early. And therefore, by the time the individual comes, the patient comes with very high pressure, target organ damage, and so on and so forth. That is just business. So we have the problems. We have multiple problems. One, poor healthcare. two intercurrent communicable diseases that also affect African
that
drivers.
compound the issue of the genetics.
That compounds, yes.
Yes, I think that's something that is very important, because we need to look at all these things and say, what do we do? So you keep talking about end organ damage, just so that people understand what it is we're talking about. I think, simply put, is things like, things like strokes and so on. Can you just explain, just briefly, what are the kind of complications that come from hypertension that you're talking about when you say end organ damage?
Okay, thank you, Dr. Ajayi. Well, very common in this environment is stroke, just as you rightly mentioned. Stroke is the commonest complication from high blood pressure in sub-Saharan Africa. Africa as a whole is stroke disease in different forms. In fact, some people can have stroke and they don't know, because we have what we call internuclear stroke, transient ischemic attacks, and the individual will have been having this and they will just say, no, there is no problem.
Can you give an example of some of these things so that people listening can understand it? And if they have some of this, and when you talk about poor healthcare, poor self-care is one of the big issues, but people are listening to us today. So if there's anything that they can identify as some of this, if you could explain, what is a transient ischemic attack? What is the intranuclear? What are these things you're talking about? Just briefly describe it, please.
Thank you very much. To make it simple, like sudden loss of vision, you just find out that you cannot see, just sudden loss of vision without anything. Then, although it to come back again, then you know that there is something up there in the brain happening. Or sudden loss of voice. Somebody who just become, or this speech, or just become a bit slowed and then picks up again, within 24 hours. Or sudden sometimes sudden weakness improves again, or sometimes some form of numbness, feeling numb on one side of the body, which gradually improves again. All this, especially the one that is commonest, that often occur to people, is sudden loss of speech. Just find out that, oh my, they couldn't speak, and by evening they are able to speak properly.
Those are big alarm signals, very, very big alarm signals. And I think it's important that people listen to these things and know. I mean, a lot of people do know about headaches and so on, but these things that we are talking about, unfortunately, a lot of people attribute them to, spiritual attacks. They attribute them to somebody in my village doing something. They attribute them to all sorts of things instead of realizing that these are some of the things that are medical and that need urgent attention. Dr. Chinasa, you're a lifestyle medicine specialist. And, we've heard all the, discussions with Dr. Ali as a cardiologist. Can you tell us, because she did talk about those lifestyle issues, people who are out there, what are the kinds of things they should do? Because we're talking about how to live longer, how to care for themselves and how to live longer. Because a lot of people have high blood pressure. A lot of them have inherited them from their parents. Some know, some don't know. What should people do? If you were just talking to people afresh now, and they're saying you can do something to live better, to live longer, to live healthier, how should they start?
So first things first, I'll say is, hey, you have to be intentional with your health. I think that being aware of how you feel, being aware when something is off, even something as simple as a headache, and listening to your body is like the first step. Because I always say the lifestyle won't focus on the non-modifiable risk factors, because the modifiable risk factors are a whole lot. And is it possible then for us to modify the modifiable risk factors? Yes, we can change how we are eating. We can change, do we smoke or not? We can change, do we take alcohol or not? We can change how we manage stress, even in a stressful environment. So the first things first is, hey, be intentional Be intentional with this. And even if it's in your family, from your great-grandfather, everybody has high blood pressure, it does not mean that you will have it. Recent studies are showing that genetic predisposition on health variants is around 10 to 30%. That means that you have a 70 to 90% chance of not carrying over the family tradition or being a descendant of a hypertensive family. So it's like a loaded gun. A loaded gun can sit loaded for the rest of its life until it is fired. That is where lifestyle comes in. So with lifestyle, we talk about nutrition, we talk about physical activity, we talk about stress, avoidance of substance use like tobacco, alcohol, and of course, social connectedness, which we do not lose sight of. So that's pretty much the whole angles we'll talk about. So now, do I go right into them?
Yes, we need to do that. But before we do that, I want us to talk about self-care. You talked about being intentional, and that's important, and being aware, but people need to understand how important self-care is, because often people leave that care to somebody else. And as you said, they don't wait, they wait until symptoms are overwhelming. Meanwhile, high blood hypertension has been there. I mean, as on this program some years ago, I had a 17-year-old boy who had hypertension discovered when he had an injury on the football field. So, of course, by the time you have somebody say, oh, he was 31 and he slumped, often young people just don't think that this thing could happen to them. So when we're talking about being intentional, we're talking about being intentional from a very young age. And even for those who already have hypertension, is it possible to then also modify their risks? So it's not just talking to those who haven't got it to prevent it. I would like you, when you're speaking, to talk to those who already have high blood pressure and talk to them about what things they need to do to try and ameliorate those risks or mitigate those risks and try and, at least at the risk of having complications and the risk of death. So please, carry on.
So I'll first of all say, imagine your body is the only vehicle you have to run this thing called life. Pretty much it is, actually. The body is the only vehicle you have to run life. So if your body is a vehicle, what kind of vehicle is your body? There are certain cars, certain luxury cars, you don't just pour in any type of oil into it. There are certain cars you don't just call any mechanic, or you don't call an electrician to fix something wrong with the battery. Now, but there are certain other cars, like if your body is a Corope, for example, or a Keke Napep, you use your mouth to feel the filling well tank, it will run. But if you do that, you buy any type of black market for a Range Rover or a Lamborghini, it can even knock engine, and you have to spend a lot to repair it. Now think about it. If your body is a vehicle, what kind of vehicle is it? Is it a 1976 Passat that you're trying whatever goes? Or is it a luxury vehicle that you are going to be intentional with who touches the car, what you put into the car? So whether you're hypertensive or you're non-hypertensive, think of your body first like a vehicle. And then now, what do you put inside? What kind of fuel do you put into your body to help it run? One thing that is pretty much standard when it comes to high blood pressure is sodium restriction, salt restriction. Somehow we are a very salty nation. We love we love our food, salty, and over time we have gotten saltier. And somehow, with the increased sodium consumption, which especially is in processed foods, aside from the one we put in ourselves, it has worsened our risk. We'll say, oh, my ancestors ate that way. And I tell people, my grandma, I can't remember her using certain seasonings, She was pretty much going basic, the traditional African, but we don't even want to do that anymore. And that is the first step, literally, that once sodium is restricted from the diet, you start seeing changes in blood pressure as soon as within 7 days, from up to 2 to 5 degrees. And that already changes your course, changes your prognosis, it changes your outcome. So first things first, limit salt. The American Heart Association usually recommends 1,500 milligrams of sodium per day. And that is actually 3/4 of a teaspoon. Now, I like to emphasize that this is not teaspoon of drinking tea. This is teaspoon of baker's teaspoon, which is standard worldwide. 3/4 of that is like just a pinch. And most of the time when we're cooking, we're just putting in salt until you hear your ancestors' voice saying, my child, it's okay, don't put it in. And then we stop. We need to be intentional with our salt intake. We need to also be intentional with, we somehow love processed food so much where we start relate, oh, I'm eating packet food. We relate that to affluence. And that mindset, we need to change that mindset. That you're eating from you go into the regular market and you buy your foods and eating the ones in the packs on the shelf does not mean that you are richer than this person. You're just eating what choice of non-communicable disease you want. It's a buffet. That is just it. So we have to start going back to the basics. There was this study that was done like in the 70s in Uganda, and it showed that even in adults as old as 50, 60, there was no atherosclerotic plaque found in the postmortem. There was none. But over time, the westernization of Africa, we've pretty much vulgarized the whole continent. So we're no more eating the basics. We're not eating how many people eat fruits and vegetables. The Global Burden of Disease study showed that eating fruits and vegetables, at least 5 servings a day, reduces risk of any form of heart disease by up to 20%. Just eating fruits and vegetables. So can we reduce our risk by eating more vegetables? Can we reduce our risk by being intentional with what is around us? Because I'm not saying go eat broccoli. Eat your ugu, eat your ewedu, eat your spinach, eat your corn, okra, eat that. What is in season now? Mangoes are in season, there's cucumbers, carrots. Go for what is in season. It's sustainable and affordable when you eat fruits that are closer to you. So always think, how far from the farm did my food go? That will guide you to know the level of processing. So when you think, this carrot flakes, how was it made? You think about that. But when you say carrots, you can easily think about regular carrots, how far from the farm to your plate it is.
It's very good.
So the processing of the food, decreased processing of foods will help change the game.
I think, this is so important. This is so good. But unfortunately, you won't believe time has gone. We have 2 minutes, less than 2 minutes to end the program. So I think that, what you've talked about in terms of nutrition is absolutely excellent. And I think that it's something that a lot of people can take on board, because the issues, as you said, eating of pizza, people thinking that it's a good thing, and it's not. The whole world is trying to go back to nature and eat the way we can easily eat. And we are trying to rush to where they are coming from, and it's not helping us. So it's something that's excellent. But I think one of the things I think people should do, before I give you an opportunity to say your last word, is I really think it's important that everybody tries to get their blood pressure checked this month of May. For everybody who is listening, if you can try and get your blood pressure checked, we're going to try and look out for, and we want to encourage anybody who has a medical mission anywhere that's happening this month to let us know, and we will publicize it. But just in case you want to know, you can walk into any pharmacy. Most pharmacies will do a free blood pressure check for you. So please, let us just start with that. So if we can, Dr. Chinasa, a few last words for our listeners before I go to Dr. Ali.
Okay, so last words, pretty much, eat food closer to the ground. And I didn't talk of exercise, just walk. Commit to walking 30 minutes daily. Don't run, don't go to the gym, just walk. Something as basic as that. And be intentional about your body. Remember, if your body is a vehicle, what kind of vehicle will it be? It depends on you.
Thank you. Dr. Ali, your last words, please.
Okay. My advice to the listeners, one, everybody, every adult from the age of 12 should begin to check their blood pressure. Know your figures. Gone are the days when it was thought that high blood pressure starts from the age of 40. But just as we've been saying here, 17-year-olds succumbing to elevated blood pressure. So it means that from the age of 12, which is the adult age by the WHO, everybody should begin to have the consciousness of checking their blood pressure. That's number one. Then number two is, once you have been diagnosed with elevated blood pressure, please, please, and please, it is not a curable condition. You must consistently check and use your medication, as directed by the physician. And one thing I always say again is that please visit the specialist. Always at one point in time, visit the specialist so that you can be properly managed, have the target optimal blood pressure goal treated, so that you don't fall victim of, oh, I've been seeing doctor, they said my blood pressure 150/90 is normal, or the doctor, said I should stop my blood pressure pills. Please, it's not a curable condition. You must treat it. The treatment is for life. Thank you very much.
Sorry, Dr. Ali, you were about to talk about the importance of salt. Please carry on.
Yes. I remember there are quite a number of articles on salt and hypertension and high blood pressure, and then we came to a conclusion, and the conclusion is that the manufacturers of food, from especially the American FDA, the Food and Drug Administration in America, they came to a conclusion whereby the manufacturers of food are kind of, they are levied when the quantity of salt in packages, in food, especially discount food or drinks or something, exceeds a certain level. So they had to go into the manufacturers, because if you throw out quite a number of things out there, people might not know. But if we go to the basis, to the foundation of production of these items, then they can help the society in minimizing their salt intake. That is item number one from the manufacturers. And then,
Dr. Ali,
yes,
what is the
yes, ma'am.
Nigerian Society of Hypertension doing about some of those packet noodles that are containing excess amounts of salt? Have they gone to challenge them? Is there anything that can be done?
I must confess, we have a long way to go in this country. Just like so many things have been affected, health is also being affected. I can only speak of FDA, but I don't think Nigerian Society of Hypertension has, been able to curtail.
Well, we can talk to NAFDAC, can't we? How about so long? Dr. Chinasa, what is our lifestyle medicine doing? Why don't we take it? Why don't we challenge NAFDAC? Tell them that they need to do something about it. They are the regulators who can actually modify some of these things. Dr. Chinasa, are you there?
So, yes, I'm here. So when both the NAFDAC, both SON, the Standard Organization of Nigeria, they all have a role to play. But I think it's better for why we're focusing a lot on individual education is that don't leave your health in the hands of businessmen. It's a business. It's important to not forget that. Now, you see what happened with the American Association. They said, hey, these people, you should not have this amount of salt in food. What did the manufacturers do? They specified the serving size. And they reduce the milligram per serving size. Now, a typical serving size of cereal is somewhere around a 1/4 cup. Have you seen how small a 1/4 cup of cereal is? Nobody measures that. Literally, we are eating a bowl of cereal. Now, when you take them to court, they tell you, hey, we specified the serving size, but that serving size will literally feed a puppy, not even a real human. It's very small, but they are justified because the serving size per sodium per serving size was within the recommendation. But now humans, we can't eat that small portion. We are eating a bowl of cereal. Nobody eats a handful of cereal.
So I think then we're going back to this issue because we've been challenged on this program, and they're asking us, saying, look, what can we do, or what can be done to make people more aware of the salt issue? Because already we've got that genetic predisposition. Already we have the complications, as mentioned by Dr. Ali, the issues of added communicable diseases. There's so many things that are going on. But this salt issue, we can do something about it. I mean, we haven't even gone into MSG.
So, you know the thing, people don't understand that. I think people don't understand that you actually do not need to put in salt and still put in seasoning cubes. In my home, for example, I've not had seasoning cubes in my home for more than 7 years. So my kids almost can't remember how the seasoning cubes, they know when they eat out, the food is extremely sweet. But they're not conditioned that way. We're not ready to decondition ourselves. It takes 14 to 21 days for the taste buds to change. Now, the human adult cannot wait for that 14 to 21 days. Typically, when people even eat what I cook, they go, oh, there's no salt in it. But for me, I feel, oh my God, the food is extremely tasty because that is a conditioning on my part. I first had high blood pressure at 16. So I already knew that, okay, genetics had caught up. It was now time for me to modify my lifestyle, or whatever happened to your grandfather will happen to you. And because I had to make these hard changes. But now it's a lifestyle. Question first is change is one thing that we're not ready to, adapt to. And food companies, they keep advertising food with emotions. They advertise food with relationships. Look at all the food brands that are supposed to be pulling them down. They don't sell their products on their adverts. They are selling emotion. They are selling connectedness. They are selling that when you eat this food, when both of us eat it, we're going to be more in love. And because they keep playing on the emotion of the consumers, it's hard. So now it's now left for the consumer to say, hey, I don't want to leave my hands I don't want to leave my health in the hands of business people because it's business for them. I don't know who saw the interview with the Coca-Cola director on BBC. And they asked him, see how much sugar is in this can? And the man says, well, and it's like, it's absurd. The interviewer is like, it's absurd. And the director says, well, that is why we list it out on the can so that the consumer makes an informed decision. So they threw back the responsibility to the consumer. And the consumer is wondering, why are these people not doing that? So the question now is, are you ready to take action for your own health?
No, I think this is it. I think we all have to take responsibility. But as Victor was saying, the important thing is that people need to know that they have to have that responsibility. There are only so many people listening to our program. How many more people are out there that need to know? We have to get that message out somehow. But thank you very much. I really appreciate this discussion.
Thank you for watching. Please like, share and subscribe for new video updates.